My name is Destiny, and today I will be talking about strokes.
What is a stroke? A stroke is also known as a cerebrovascular accident, or CVA. It is a condition where blood flow to the brain is restricted. The brain uses 20% of the body's oxygen supply, despite it making up 2% of the body's mass. When the brain does not receive oxygen, brain cells become damaged and can eventually die. In neurology, there is a saying that time is brain. A study provided a quantitative assessment of this adage by estimating that 1.9 million neurons and 14 billion synapses are lost per minute due to ischemic cerebrovascular disruption during a stroke. Types of stroke. There are two main types of strokes, ischemic and hemorrhagic. During an ischemic stroke, blood flow is blocked either by thrombosis or emboli. Narrow arteries cause blood cells to collect and form clots. A thrombotic stroke is when cerebral arteries become blocked by a blood clot formed in the brain. An embolic stroke is when the clot is formed in the peripheral arteries and then breaks off and then travels to the brain. It's common for these to come from the heart. Hemorrhagic strokes occur due to a weakened blood vessel rupturing and bleeding into surrounding tissue. Intracerebral hemorrhage is bleeding in the brain tissue itself. Subarachnoid hemorrhage occurs when a blood vessel just outside the brain ruptures and the area between the arachnoid membrane and the pia mater rapidly fills with blood.
Other types of strokes include TIA, cryptogenic stroke, and brainstem stroke. A transient ischemic attack is a temporary disruption of blood flow that normally resolves itself but can be a warning sign that a major stroke is coming. More than a third of people who have a TIA and don't get treatment have a major stroke within 1 year. Cryptogenic strokes are strokes that do not have an identifiable definite cause. They make up 30 to 40% of ischemic strokes. Brainstem strokes can be ischemic or hemorrhagic and are the most lethal type of stroke because the brainstem controls many of life's vital functions. Causes. Ischemic strokes are caused by thrombosis, emboli, and stenosis. Stenosis of the arteries is most commonly caused by atherosclerosis. Other causes include traumatic injury to the blood vessel of the neck or disorders of blood clotting. For hemorrhagic strokes, the most common cause of an ICH is high blood pressure. Less common causes of ICH include trauma, infection, tumors, blood clotting deficiencies, and abnormalities in blood vessels. SAH is most often caused by cerebral aneurysms. SAH may arise spontaneously or due to trauma with the sudden buildup of pressure outside of the brain. Risk factors. Risk factors for stroke are hypertension, heart disease, diabetes, smoking, birth control pills, high red blood cell count, high blood cholesterol and lipid levels, obesity, sedentary lifestyle, excessive alcohol use, substance abuse, abnormal heart rhythm, cardiac structural abnormalities, age, race, gender, history of stroke, history of TIAs, and genetics. Also, where you live, your climate, and socioeconomic factors can also influence your risk. Symptoms of stroke. Since the brain controls the whole body, stroke can have a wide range of symptoms depending on the location and amount of affected area. Symptoms occur suddenly. Some symptoms are numbness or weakness of the face, arm, or leg, especially on one side of the body, confusion, trouble speaking or understanding speech, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance or coordination, and a severe headache with no known cause. Right-sided strokes will affect the left side of the body, and left-sided strokes will affect the right side of the body. How to recognize signs of a stroke. You remember the acronym FAST. So F is for face. You're going to check for facial paralysis. A is for arm. You're going to check and see if one arm is weak or numb. For S is speech, so check if their speech is slurred or if it's difficult for the patient to speak. T, time. If any of these symptoms occur, it's time to call 911 and make sure to call even if the symptoms go away. Role of imaging for strokes. Primary modality is CT. Non-contrast CT is the first type of scan done on a suspected stroke patient. It can be used to rule out a hemorrhagic stroke, and they're useful to help detect lesions because they are sensitive to calcium. A brain CT scan can show whether there is bleeding in the brain or damage to brain cells from a stroke. It is used to find abnormalities and can help find the location or type of stroke. Findings of a CT will be different depending on the age of infarction. The ages are hyperacute, subacute, acute, or a chronic or old stroke. Other uses of CT are CT angiography, which uses a contrast material to image the blood vessels. It can be used to detect any vessel thrombosis or occlusion, vascular malformations, dissection, vasculitis, and aneurysm. If you look at the figure below, you'll see at the white arrow there is a cutoff where contrast is not flowing. That's going to indicate a site of thrombosis. Another type of scan is the CT perfusion, which uses a rapid bolus of contrast to observe brain parenchymal enhancement. The speed of parenchymal enhancement is proportional to blood perfusion. The measurements from this scan are going to be used to detect the core infarction.
Here are my images. They're an axial view of a non-contrast CT of the head. Starting with image 1, you can see a radiolucent area that shows up black with well-defined margins and a reduction in brain parenchyma. The area of hypoattenuation in the posterior portion of the right side of the occipital lobe is suggestive of a chronic or old stroke. The images show that as you move superiorly through the brain, the loss of tissue continues, but gets smaller the further you go up. The patient had a history of a prior stroke that affected the right side of the brain. During the original stroke, she presented with left side muscle weakness in her arm and leg, loss of vision in both eyes, ataxia, and severe headache. Stroke imaging MRI. MRI uses magnetic fields to find small changes in brain tissue that helps to find and diagnose stroke. An MRI has a higher soft tissue contrast that is superior to CT in hyperacute and acute phases. Diffusion-weighted MR is the best sequence to detect early brain infarction. Diffusion-weighted MR is a highly sensitive, specific, and accurate method used to detect stroke within minutes after onset. Diffusion-weighted MR has a high signal intensity where random water movement is restricted. For an MRA, that can be used to check the blood flow through the arteries.
Other types of imaging for strokes include Doppler ultrasound, PET scan, and angiography. Doppler ultrasound looks at the carotid arteries to see if there's any narrowing or blockages. A PET scan is going to use glucose to look at the metabolic activity in the brain, and it can help locate regions of ischemia and necrosis. It can also look and see if there's a hemorrhagic stroke present. Angiography is a useful tool to visualize slow blood flow through a constricted vessel. It allows the interventionalist the ability to treat an occluded or stenotic vessel or vascular malformation. Ischemic stroke treatment. Procedures. A thrombectomy uses a small device that passes through a catheter and into the artery in the brain. The blood clot is then removed. A carotid endarterectomy opens up the carotid artery and removes fatty deposits. Medications, there's going to be tissue plasminogen activator or TPA, which is a thrombolytic agent that acts as a clot buster, but it must be used within the first 4.5 hours of symptoms to be effective. Aspirin, other antiplatelets, anticoagulants, blood pressure medications, and statins can all be used to help reduce the chance of another stroke.
Treatment for hemorrhagic stroke. Surgeries done are to remove blood from the brain, relieve pressure in the skull, and repair burst blood vessels. Surgery may be done to remove an AVM. An aneurysm clip may be used, or coil embolization to treat the hemorrhagic stroke. Medicines that may be prescribed are blood pressure medications and medicines to reverse anticoagulants. Prevention. Rehabilitation plays a key role in a patient's recovery. The goal of rehabilitation is to restore function as close as possible to pre-stroke levels or to develop compensation strategies to work around a functional impairment. Recovery rate for each person is different, and the road to recovery varies depending on many factors such as severity of stroke, the time of treatment, and the individual. Physical therapists, occupational therapists, speech therapists, and psychological therapists can all help with the long-term effects of stroke. A patient looking to reduce their risk of stroke can stop smoking, manage their blood pressure, eat a well-rounded diet, control their cholesterol, be more physically active, reduce their blood sugar, and maintain a healthy weight. Prognosis. Stroke is the 5th leading cause of death in the United States. Every 40 seconds, someone in the United States has a stroke. Every 3 minutes and 14 seconds, someone dies of a stroke. About 185,000 strokes are in people who have had a previous stroke. Stroke is the leading cause of serious long-term disability, and stroke recovery is heavily dependent on the severity of the stroke, type of stroke, the area of the stroke, and the individual. Fast medical care and treatment can improve a patient's prognosis. Ischemic strokes have a better prognosis than hemorrhagic strokes. Hemorrhagic strokes have a high morbidity and mortality rate. TIAs have the best outcomes, with symptoms generally resolving in 24 hours. TIAs can act as warning signs that a larger stroke may happen. Here are my references. Thank you.